Greetings, everyone. My name is John Arrasjid. I'm CTO for Ottometric. I'd like to talk to you about risk management and mitigation in the age of quarantine. Today, we're faced with many challenges under the current pandemic, including health and the economy. Both are interrelated. Many, if not all of you, know someone who has contracted this new coronavirus. I have individuals that I know personally who have it. I do know of several people who have passed because of it, and I think it's a very serious thing that we need to think about. My talk covers what you need to think about and ideas one might want to look at that you can do for yourself, your company, and for your community. So let me get started first by giving you a little bit of my background in relation to what I'm about to talk about. So people know me as a VCDX, people know me as a V-Expert as well, but I'm also FEMA certified. FEMA is the Federal Emergency Management Agency within the United States, and they have set up a number of things to deal with disaster recovery. I currently am a member of the Community Emergency Response Team for my town, and this is where I'm responsible for acting as the local CERT team contact to coordinate between federal and government agencies and our CERT response team. I have also been at Dell and VMware and other companies, been a medical emergency response team member dealing with emergency response. And I've also done significant work at the Burning Man event and as part of the emergency dispatch operations, where I worked with 911 dispatch and interagency communications. So this gives you a little bit of my background in BCGR. I do have some training in epidemics and pandemics as well through the FEMA community training program. I also want to do a quick background on some of the books that I've written. Some of you may have seen or known these. I've done a lot of work on VMware technologies, on certifications, but I've also done a lot of work on infrastructure design. This year, the IT Architect series has one new book that's coming out with input from the community, a number of different contributors to this, and the title is called IT Horror Stories from the Field. So look for that. We'll be coming out with that later on this year. So this gives you my background as a quick rundown on my credentials. Let's go ahead and start looking at the challenges and the hurdles that are faced in a pandemic. So many people think, what do we do about a situation like this? You know, how is a technology affected by a pandemic? It's the technology itself, or the technology piece is not what's actually impacted. It's actually the people and the processes that are used in support of that technology or in using that technology that are. So although I will talk about technology, there is also a lot about that I will cover on operations and how to deal with the people and the process and make sure that you're successful in this situation. So some things to think about. How do you provide required services if you've got tens, hundreds, or if you're in a big company, thousands of staff that are unable to report to work? Hopefully, this is something that they will all be able to recover from, but there are some people who may not be able to work because they may not have the equipment, or they may be sick, or they may be in a situation where they just can't do what's needed. We have to understand in each of us our company's vulnerability and how employees, customers, supply chain, and the community are impacted. All of those have an effect on each other. And you can see this already. I live in Santa Cruz, California. We've already run into a lot of very interesting issues. Some seem humorous, like the shortage of toilet paper, which is a little crazy, but we also have a shortage on medicine. We also have a challenge with the ability to have meetings with our doctors and so on because of the self-quarantine. These are things that can affect you from your business standpoint also, especially if you do a significant amount of your meetings in person in meeting rooms. Be safe. There are many people who are affected, including many leaders from many countries, including what we've learned recently this morning with what's happening in England right now. So one of the things I would like to call out is that as a VCDX, there's a practice that we use that's tied to how do we look at a problem from the higher level categories of availability, manageability, performance, recoverability, and security. And one of the things that I want to point out is this applies to more than just the technology. The same areas apply to when we look at how do we deal with planning for people and process in our environment. Many people will look at operational considerations, but think about how do you deal with remote support, the availability of individuals to do work. How do we make sure that they can get access to that equipment? How do we ensure that there's performance and so on? I mean, one of the lessons I'll talk about a little later is what we found with a lot of remote workers, that the communities that we all live in are not designed for business level network communications. It's designed more for residential. And this is one of the things that we'll find when supporting more users at home, what level of bandwidth and what latency considerations we need to look at for each of our users. Now, what are some of the approaches that we can take for risk management and risk mitigation? So first off, I'd like to talk about creating what I like to call a self-healing environment. Years ago, a friend and I created an ISP called Web Nexus Communications, and in that, we focused heavily on trying to find a way to provide a self-healing environment. Now, we can do this today with a lot of the newer technologies that are out. We can do pre-approved actions through automation to respond to particular issues. We can consider adopting AI for autonomous response, or even to use spare computing cycles for other purposes beyond what they were originally intended. And we can identify potential issues using vendor and community information. One of the reasons why I do like Runecast Analyzer technology is because of all the capabilities in being able to do remote analysis, looking at community information as well as vendor information for identifying problems and solutions. But the idea here is, what can we do to create our environment to be as self-healing as possible and allow people to do the work that they need to do to keep the business operational? The next thing is looking at your team. The team is one of the most important areas, because without the team, you don't have a business. You can't operate the business. You need to provide your team with the tools that are needed for telecommuting. Many of you who are joining right now are already aware of this. Many of you are familiar with all the different types of remote working at home type of technologies. But I wanted to call this out because not everyone always thinks about some of the ways that you could use different types of technologies. As an example, internet access, we have to think about what I mentioned earlier, bandwidth and latency and accessibility to the equipment at your facilities, whether they're in your own data center or within the cloud. We can look at virtual desktop infrastructure to support users so that they have their own remote desktop. Many of you are familiar with that, but again, we have some new people that may not be familiar with all the ways that VDI can be used to help in this situation. And of course, there are other areas, VPN for secure connectivity, video conferencing, and I'll use the term et cetera, because obviously there are many more that I can list here. Another area that has to really be looked at is your business continuity plans. Yes, we're in the middle of a pandemic right now. And yes, many of us are in very challenging situations. But we do have to look at evolving our business continuity plans, take an agile approach to say, look, this is what we planned for. We now have changing circumstances, and we need to think about how do we adjust for these new circumstances, adjust for some of the risks that are happening, and how we can actually mitigate that. So you need to think about what you can do if you can't get access to your BC plan. So for example, if it's on a computer system at the office that does not have network connectivity, that may be a bad thing. You may need to think about who has copies of those business continuity plans. And these are plans not necessarily from the technology standpoint, but from the operational standpoint. The other thing that I want to do is make a call out, and this can be a call out for individuals at a personal level or at the company level. There's a project called the Folding at Home project, which is designed to take advantage of spare compute cycles, whether they're CPU, GPU, TPU, or other type of compute capability, to give the research scientists more support. This is very much like the SETI at Home project many years ago. How can we work together, share the extra compute power that we might have to be able to handle solutions and solving the problem and coming up with a cure, a vaccine, and newer tests. So what am I doing? I work at Ottometric, and we actually have a very diverse team, maybe not as diverse as some of the other teams on the call, but we do have employees in North America and in Europe. We have instituted a self-quarantine for our employees, and so all employees do work virtually from home via VPN in the cloud. But there is one thing that we have found in doing this, and I've noticed this because I do live in an area that is a little bit more residential, less businesses. I do have a business class service at my house, but I still run into some of the issues that I list here in the third bullet item of network latency and bandwidth saturation. And so you have to think about not only what your equipment can handle, but what can your infrastructure handle going out from your house to your business, and how does your service provider and all the connectivity between that handle the load that is now being increased. So far, it seems like things are working pretty well in the bigger cities as far as network bandwidth and not having latency issues. But in rural areas like where I'm at, it is becoming more of an issue. For example, we typically turn off video conferencing pieces when we're doing video conferencing, meaning let's not show the pictures of our faces, let's just focus on the presentation. Just an example. The other thing that we do is looking at our customers. The tool that we have allows validation teams in the automotive industry to process more data while they're working remote. And this allows them to get more results in a shorter time. We use things like computer vision, AI, and other proprietary analytics to help with dealing with big data on the order of petabytes, but instead of spending months, we can spend hours and do it automated versus manually. These are some of the things that I wanted to call out for businesses that are out there that have the ability to do this. This is one thing that can provide additional value prop in this current situation. We're hoping with our tool that we can actually assist many of the automotive companies with their validation testing at the tail end of their development and production cycle for release of safer vehicles. Now, what are some of the considerations that we can take? So there are lessons that are learned from past epidemics. So why do we want to be proactive? We want to avoid loss of productivity due to absent team members. We also want to balance immediate versus delayed impact to the business. What we do today may seem very expensive, but if we don't do those things that are being recommended, what is the cost long term if the pandemic becomes more spread more widely? So let's take a look at a couple of examples here. So we've got, in the past, we've had SARS, MERS, Ebola, all of these, I believe, are coronavirus type of viruses. And we've learned from those on how to deal with things from an operational standpoint. One of the things that I've done as I research this is looking at all the different technology-related items that governments and businesses have listed that somebody could learn from. And there's actually a lack of a lot of that. That's one of the things that I found is that people are focused heavily on the people in the process versus the technology. The technology in many cases can operate very well without being impacted by a pandemic, but it's the people who are operating and using that gear that we have to think about. So what can we do? We can look at the lessons learned to actually help us be more successful in getting through the coronavirus. That could be anywhere from months to potentially up to, from what I understand, a year and a half, maybe longer. We'll see what happens. I hope for a short situation, but this is designed to help you with some of the thoughts around that. So for considerations for business continuity, there's people, there's process, and there's technology. So if we look at the people, there's the workforce. That should be a very top priority because without the team, you can't conduct your business. Staffing shortages may apply. We've had that situation across several companies of friends that I know of. This is where they may want to think about dividing teams across locations and limiting visitors. But in this particular situation, I think it's a little bit more severe in thinking about how do you deal with locations. Do you actually allow for visitations? Do you have meetings at those locations? What is the risk? What are the precautions? I'm not going to make recommendations here because I do believe that limiting social contact is going to be very important, and we're going to have to be more creative in how we think about in-building meetings in this current situation. Also, from a management standpoint, we need to think about the chain of command, backups for each individual who is supporting the other person in case they're sick or cannot make it to the office or get access to the computing environment. And we also have to think about the worst case scenario of succession. How do we make sure that if that one person who did this one role is unable to work for the next year, for whatever the reason might be, well, how do you handle that? How do you provide support? And when that person does return, if they're able to return, how do you reintroduce them back in and give them the ability and the support while they're out and while they're coming back into the work environment? Process. I don't hear a lot of people talking about process, but there are a lot of things that we can think about. I listed one right here, online meetings and collaboration tools. We can list out a number of the ways that these can be functional. I mentioned a couple of things right now. Using a video of everybody's face with the camera may be something that will introduce problems for those that are working remotely in residential areas. So that's one recommendation that I would make. Another recommendation is looking at testing out all of your tools where you can to ensure that the remote workers have the access, have the functionality, have the right tools in their environment. In some cases, I've talked to some individuals who chose to use VMware Fusion, VMware Workstation, or other virtualization technologies on people's desktops to give them another environment similar to like what we might do with virtual desktop, but instead give them multiple environments on their desktop, especially in the case of support engineers who may want to have different environments that can be quickly brought up for a support call. Now let's give you some examples on technology. First, I'm not giving implicit endorsement of any of the things that I list here, but I do believe these are things that are valuable because I have used them before. Google Hangouts, Zoom, GoToMeeting, and other video conferencing tech has become very essential today. The majority of the time that I am doing meetings, I am in video conference calls. Even if I am not using my camera, I'm still using it because of the way we can share information, do virtual whiteboards, and so on. Also, there are some things to think about. Controls that are normally enforced in internal network environments may shift to external networks and potentially unmanaged endpoints. This is something that was called out in one of the papers that, that I was looking through for ideas around what do we have to think about in technology. And there may be some individuals that will be able to cover this, including one of the speakers that's coming after me, a good friend of mine, Chris Cusick. Let's go to the next thing, and this is talking a little bit about my understanding of the Runecast pandemic response. What is Runecast doing in response to society and customers? These are my good friends that I've known for well over 10 years through my work at VMware and Dell and Virtustream and other companies. And I've watched what they've done in their tool, Runecast Analyzer, and how it can benefit people. Well, internally, the employees have followed the self-quarantine and other guidelines that are issued by health organizations and their local government agencies. But from a bigger aspect, they're looking at how they can help with responding to this situation. How can we help on getting a cure and things like that? One of the things that Runecast has done is provide free licensing for hospitals through September 15th to help them be more effective in supporting their environment through a lot of the technologies that are offered and all the capabilities that are offered within that particular tool. You can check the website for Runecast for more details on this if you are in the healthcare industry. Part of this offering includes checks for HIPAA compliance for VMware technologies. But I would want to say that it's very important that Runecast supports more than just VMware. They have extended to supporting AWS, and I expect in the long term that we'll see more support opportunities coming from Runecast. The final area that I want to call out is that they're not just focused on hospitals, they're also looking at all organizations. And one of the areas that many organizations are looking at is the virtual desktop. And because of that, Runecast has this analyzer trial period of 14 days, but what they're doing is they're extending the analytics tied to Horizon issues all the way out until September 15th. So yet another thing that Runecast is doing to help in this particular area. So I wanted to look at the tail end of where we want to be, and that is with a successful outcome, with the help of science, which gives us hope. I wanted to cover some of the things that I found recently as some simple notes on what research is doing to help us get through this. So there's this phase 1 clinical trial that's happening in the state of Washington, in Seattle, that is designed to be a vaccine that's designed to protect against COVID-19. There is also another randomized controlled clinical trial on the safety and efficacy of the investigational antiviral called, and this is where I'm going to have a challenge on pronouncing, remdesivir. Sorry, I actually don't know the exact pronunciation, but this here is designed to help with those that are also affected by COVID-19, and this is being done through the University of Nebraska Medical Center in Omaha. Another thing that's being developed that's close to home, where I live, is at Stanford, and there's a test for these antibodies that help to understand if an individual has been affected by COVID. And this is a simple finger stick test, 1 drop of blood, very easy, very quick, much easier to administer. And the way that they're doing this in our area is Stanford has set up an area in one of the local park areas in Los Gatos, which is close to my house, where they have drive-through testing that is very quick. And the testing does not take weeks or longer that we've seen with some of the other testing that's out there. So I think this aspect of science is giving us some hope on an end to this situation and finding a cure or a solution to get us through this with more safety for individuals that might be affected. Another thing that I wanted to call out is what we talk about as the flattening the curve for COVID-19. So we look at this red peak as showing, a high mortality rate. It's initially started, you start having this pandemic. It grows pretty fast as we're trying to learn how to adapt to it, how to take care of people, how to deal with potential shortages of hospital or medical facilities. And the idea of flattening out the curve is to minimize the number of people who get affected so that it's below or well below, hopefully, the ability of the hospital's capacity, meaning let's not exceed the capacity of the hospitals, otherwise it gets more challenging. And we've seen the challenge of this in places like Spain and New York City, and there's a number of other areas around the world where we've seen this. So on this point, let's think about where we've seen success in slowing the spread, flattening the curve, and helping give researchers more time to find a cure while we don't overload the medical system. We have more people that are learning to live and work remotely. I fortunately have learned how to live and work remotely, sorry, not live, but work remotely for many, many years, as do many of the people that are on the call. But we do have to also think about how do we learn to adapt to the changing circumstances and supporting those who are lesser able to support themselves. That's one of the reasons why I volunteer for the CERT team in support of our community. And I would recommend others to consider that as well. The other final piece on the science and hope area for this slide is on business continuity and contingency planning and looking at how they're being reevaluated and revised. Again, we may have taken a waterfall approach on developing our initial business continuity and contingency plans. I've done that myself, but I would like to actually consider looking at how we might, sorry, fixing something here, on how we might adjust our BC and contingency planning in support of something like this, which is very new, a very new experience for many of us. Now, what are some of the tools that we could use? Well, think about the tools that are used in lights out data center operations. These are the types of tools that can provide a huge advantage. They include things like virtual desktops, as I mentioned before, the AI that I mentioned to create self-healing environments, but there are other types of technologies as well. In many cases, automation is one of the key foundations. Using a tool like Runecast Analyzer with VMware's some of VMware's technologies for operations and automation are very good. You can trigger particular actions to happen. You can have pre-approved rules. I won't go into the details of those. You can find that out from the different product literature that's out there. But I do think that there are tools in place today that can really significantly help in managing an environment with a lot of your workers out of the office. I do want to call out that it's very important to think about support of mission critical needs and including use of simulators for things like upgrades to test things out beforehand and try to do as much as you can remotely. One of the examples that I thought was very interesting is the story with DLR. which is a company that's in Europe that focuses on supporting the German Space Operations Center, GSOC, and they use the Runecast analyzer for this and have found it very successful. And I kind of look at this as we're looking at mission critical and something similar to this. There are a lot of challenges right now from health and safety. What can we do to help individuals, the administrators of these environments, as well as the management teams and the project leads to help manage their environment and be more successful as we work remotely more often. I now want to cover what I have taken from FEMA. This is the Federal Emergency Management Agency, their checklist, because I think it applies. I've adjusted it slightly in relation to the experience that we're going through right now. This was designed during the times of SARS, MERS, Ebola. It's evolved over that time. It will continue to evolve with COVID. There are other regional checklists that you may find from your government or from your region. I believe the EU has specific recommendations around this as well. But let's go through these. I won't go into all of the details because of time, but I will try to spend enough time to kind of give you an understanding of why these are important. So thinking about program management plans and procedures, what are some of the things that you need to add for procedures and objectives to make sure that you have the right performance for your essential functions? Can people do their job? Can you get the response time that's needed, not just from the technology, but from the team members who may be affected at this time? What are some of the essential functions? Consider performance of essential functions beyond 30 days, because we do understand this is going to take some time, and in different regions, it may take longer than others. Think about orders of succession and delegations of authority. So if we look at 3 levels deep, this might be one way of looking at how do we ensure that we can provide the support if one of those individuals is out of commission. They're not able to do their work, and we have a higher absenteeism rate. So I'm thinking that this is an important aspect. A lot of people don't like to talk about orders of succession because they think of the worst case scenario. That does happen, but in many cases, it's a matter of, in orders of succession, if somebody is not available, maybe they're on vacation and they're on an island somewhere and there's no internet access. Same type of situation here, different circumstances, but the same type of situation that we want to address. Also, communications and information systems, we want to consider the need for additional equipment, laptops, telecommunications gear, network capacity, mobile devices, etc., for employees so they can do their function from remote locations. And as we do this, think about it this way. There may be some labs that are physical labs that may be needed for people in the hardware industry. And how do we handle that? How do we support them? That's something that will have to be addressed company by company based on their circumstances. I'm not sure if everyone can afford to have a lab in their house. Fortunately, with software technology, it's much easier. As many of you probably do already, I have a virtual environment at home that's run virtually on top of a virtual environment. So I've got 2 levels of nesting. Not supported, but something that I'm using for some of my testing. Let's continue with the checklist. There's just a few more slides here. Essential records management. You need to test, review, and update essential records, databases, and systems. You need to think about alternate locations where you can have a support service and infrastructure to be able to continue the business as needed. I'll give you a case in point. During something called Hurricane Katrina many years ago, maybe not so many years ago, but anyways, there was one company that I worked with that had 2 offices. One was on the coast, one was about 30 miles inland. The coastal operation was their recovery site, and their primary location was further inland. So the hurricane took out the recovery site, and they were basically had no recovery site when their primary site went out. We have to think about similar types of situations on if there is, I'll give you the case in point here in New York City, a lot of people that are self-quarantine. Some of the operations for some of the businesses have had to be moved into other areas, other locations, with the remote users still being able to work, but moving the primary facilities to an area that's lesser affected by the pandemic. Human resources need to think about providing employees with information and advisories about the disease outbreak. We need to think about the guidance that's being given by health and safety authorities and really avoid some of the false information that we may get out there, some of the false news or fake news, whatever you want to call it. But what you should do is validate the recommendations that you're given. So for example, will a handkerchief help you in the same way that a N95 or a PM2 or one other type of respirator mask would give? Think about the advice that's being given and make sure that you check and confirm that advice before you move forward. Don't make an assumption. Now, the other things that we need to think about are two cases. One is called devolution, and the other one is called reconstitution. I did not come up with these specific terms. These are from the FEMA checklist. But when we look at devolution, we need to think about what happens if we have full or partial devolution, meaning we have lost a majority of our team members to support this. We have to think about how do we go through this, support the health status, help improve the health status of individuals in whatever way we can, and think about what do we need to do if critical staff become ill. For reconstitution, we need to think about the reverse of that. How do we bring back people back to the environment? How do we make sure the work environment is safe? We've done what's necessary. How do we make sure people are practicing the correct guidelines for social distancing until we get to the point where we can have a vaccine, a cure, and other types of things that will help us get beyond where we are today. And the final area that's on the checklist is test, training, and exercise. Yep, we're in the pandemic now, but that doesn't mean you can't go ahead and do some testing and training and exercises related to dealing with the environment with so many people that are going to be working remotely. We want to make sure that we can understand what's needed to maintain these essential functions for longer periods of time. These extended periods could be up to a year or longer. So let me, in the final area, I want to give a call to action. So in here, I've got a couple of items I want to mention. One, think about your business continuity plan to adapt the evolving response to COVID-19. And in this case, remember, technology for the most part doesn't get affected, but the people and the process need to evolve or need to be taken care of so the people are supported and the process evolves in an agile method to actually support these changing situations as we go forward in this pandemic. You want to think about how you can support your community in response to COVID-19 and helping those in need. Runecast has done this with the hospitals as well as users, making certain offers. Ottometric, where I work, is doing certain things for helping our customers be more successful in working remotely. And we have other things that we can think about either in our business or as individuals, as I mentioned before. The Folding at Home project is one of the ones that I call up here, where you can donate computer resources to help in the effort. And the one thing I do want to leave, because this is definitely one of the more challenging things to cover, because I do personally know people affected, and I do know people that have passed from this coronavirus. And in many cases, it's been very quick, but not necessarily, how can I say it? It's kind of hard to explain this, but anyways, I'm very affected by it because there are a lot of people that I do know that have already been impacted in the US, as well as several that have been overseas. I do recommend that you do what's right to make sure that you take care of your health and safety for you and your family, and then you can extend it out to your friends and to your company and to your community. But the more volunteers that can help where it's possible to help, I think that will make a big step going forward. And as I know from our community, this community of people that have come together through all these different conferences, those of you that are on the call, I know that we always step up and try to help each other out in many, many different ways that we can. And I recommend that you try to do the best that you can with whatever ability that you have in this. So again, this presentation did not focus deep dive on technology because right now the issue is on operations, but the operations, the people, the process definitely are interlinked with the technology. So think about that as you go forward. So with that, I want to leave you and say thank you for joining on this session. I did go through fairly quick because I know it was towards the end, but I also wanted to leave some room for Q&A. I may not be an expert on all of the different questions that may come out, but I'm definitely open to answer questions on what I know based on my CERT background, as well as my work in the past on doing business continuity and disaster recovery within VMware and within other companies. So with that, I want to thank you, and I also want to let people know that this presentation will be available afterwards, and watch for news on where you can get that information later on. So Nikita, what I'm going to do right now is I think I'll open it up for questions, and I'm not quite sure how we want to handle that. Do we handle it through you as the moderator? I'll turn it back over to you for the Q&A.
Yeah. Hey guys, so if you have any questions about John's session, any questions for John, at the very bottom you see the Q&A tab. You can type in your questions there and we'll answer them now. So Warren just posted a comment.
Okay.
He said I just looked at folding at home and they have an OVA filing. It looks pretty cool, right?
Yep. I'm planning on doing that. I mean, I worked on the SETI at home years ago. I volunteered time. Then they stopped that project. I think this is another opportunity to allow society to help contribute back into the solution. I'm planning on running the virtual machine for that.
Can you hear me?
Yeah.
Yeah. How's it going, Stan?
Perfect. Hey, John. Great presentation. Thank you very much.
Cool.
You looked at very different aspects. What I wanted to ask is, a lot of people have been bringing up the role of security in the times of pandemic, because we're changing a lot of things now, shifting the way that we're also consuming technology. So how do you see the role of, or the emphasis on security in these times?
I think it becomes much heavier. So if you think about what I mentioned about succession planning and having backups for different roles, when you have a lot of people working remotely and you have a lot of changes in who is covering certain roles, there are some aspects of social networking risk where somebody may impersonate somebody else. That's one aspect, that's on the people side. And then on the technology side, there may be a challenge, I think, on doing all the things that we have to do around security. And one of the things I would recommend is after my talk, Chris Cusick, a friend of mine, is going to be talking about a number of different things. It's tied more on AI, but he also has a background in security as well. My thoughts on this is security, when I'm doing a design, it has to come first. We have to think about all the decisions that we make to be successful. And as we go through this particular situation right now, we still have to, we can't drop security considerations. We need to think about it from both the people side and the technology side. So I definitely recommend that you consider looking at how you handle preventing situations like social engineering to try to impersonate somebody and try to get some information that could lead to a major compromise within a company.
Thank you, John. Thanks again for the great session.
Yeah, cool. Thank you.
Right.